Okay, I'm going to tell you about a high-fat phony patient, and this is kind of typical things that I encounter. Like I'll just tell you about a few other ones real fast. A lady physician, she asks me, she's having heart problems. What do I recommend? And I told her, low-fat vegan, the same thing I always say. She goes, well, she's going to the best cardiologist, in the big city, and he's the most prestigious cardiologist. I said, you've already had a heart attack. Okay, and that means you're not doing well. Okay, you need to change. He's like, well, he's the best. I'm going to go to him. I have to trust him. He's the expert. You're not really, and you're not a cardiologist. I go, I know more about coronary artery than he does. Okay, did he tell you go low fat vegan? She said no. I go, then he doesn't know what he's talking about. Anyway, she ignored me. Her heart disease got worse. She had to get a pacemaker. She didn't do well. She was forced into early retirement for health reasons, okay? And I know people who are actually known in the high-fat phony community who say one thing on the internet, but in private they say something quite different. I'm not going to go into who that is and who does that, but I'm telling you that is a fact, okay? The next thing is I've got patients who told me they were told it's okay to stay on the nuts, the seeds, all this high-fat phony stuff, and their atherosclerotic disease, their hypertension, their coronary artery disease just kept getting worse, okay? And now I just want to tell you about this patient because this is a typical thing I run into, okay? The family comes up to me and says, oh, relatively young guy in his 40s, mid-40s, with a, big shot degree, big shot job, has severe hypertension, he's taking 4 meds, barely able to control it. I said, well, he needs to stop messing around. I said, he's at high risk to have a lot of serious problems. I said, he should become a low-fat vegan, like what I always say. I told him about Kempner, about Pritikin, about McDougall, about my own work, Esselstyn, etc. And they're like, well, and I recommended, of course, the low-fat vegan diet, 100% vegan, whole foods only, single ingredient only, 100% organic, no oil, no nuts, no simple sugars, no added salt. You want to be real low in salt. No avocados, no soy, no caffeine, no tobacco, no MJ, no alcohol. That'll get his K factor up because there's a lot of potassium in fruits and a pretty good amount in starch, okay? Anyways, the family says he doesn't want to do that. He says that he heard olive oil on the internet was good for the heart, that nuts are good for the heart, and that it's okay to have 2 beers on the weekend, okay? Like if he's watching sports or having friends come over. And I said, look, he's free to do whatever he wants. But if you want to know what's best for the heart from a nutritional point of view, it's what I just told you, low-fat vegan. And so anyways, the guy didn't pay any attention to me. A year later, the family comes up to me and says, he had a heart attack. He's doing okay, but he had a heart attack. What should he do? And I'm like, what do you want me to do? Do a rain dance, Mecca Lecca High, Mecca High. What do you want me to do? I gave you the answer. You could take it or leave it, okay? And they said, well, he doesn't want to do that low-fat vegan stuff. He heard olive oil and nuts and fish were good for the heart. I said, there's nothing I can do for you. He's going to go to his doctors. They're going to put him on a bunch of medications. They're going to check his coronary arteries. He's going to have a bunch of atherosclerosis. They're going to start popping in stents. They're going to do an open heart surgery then, not too long after that. I go, that's what happens to pretty much all the patients, okay? Like Dr. McDougall said, the treadmill stress test is a conveyor belt to the operating room. That's how it goes. That's how coronary artery disease is managed in American patients. Hypertension, they give meds out the wazoo until the patient has a stroke or a heart attack. Then they add some more meds, okay? They're going to put them on all these blood thinners and stuff as well. Okay, so anyways, I also said to him, look, he's just had a heart attack. That's a freaking disaster for a guy in his 40s. What more does he need to wake him up? He's at high risk to die, okay? The rate of coronary artery disease and heart attacks in low-fat vegans is 0. What do you want? Okay, I'm used to this, by the way. This happens all the time. People don't listen and they just crash and burn. It's sort of they think that they're immune for some reason. They're a nice person. No, if you eat high-fat foods, you plug up your arteries. That's just the way it goes. And then things don't work. Strokes, heart attacks, impotence, blindness, hearing loss. It just goes on and on. Okay, so anyways, that's where I left it. I said his internal medicine doctors, his cardiology doctors, they'll give him all the medicines. He was on, 7 medications. He continued with his diet, said he was cutting down a little bit. Okay, so anyways, a year later, the family contacted me recently, and they said, you know what? He just had another heart attack, and it's bad. It's worse this time. His heart's not working well. He's in congestive heart failure. Okay, this is a young guy in his 40s. And I said, well, and they asked me, what should I do? I said, I already told you. And the family's like, he doesn't want to do that. I'm like, well, then, buy a plot in the graveyard, okay? There's nothing I can tell you. Have fun getting stents and open heart surgery. This is how it always goes, by the way. The patients, this is typical, okay? There's so many risks for stent thrombosis, coronary artery bypass occlusion. Like William Roberts said, the disease is always diffuse. It's never an isolated segment that you can just stent and you're all done. You can just do a cabbage bypass and you're all done. It's never like that. It's always diffuse. It's always triple vessel coronary artery disease of similar severity. I went through all these papers. I made videos about all this stuff. Okay, the increase in longevity is essentially zero with stents and open heart surgery. Okay, why would you choose that path? It's the choice of the stupids. Most people choose that path, 99%. Okay, why not choose the path with probably about 100%, let's call it 99% cardioprotection? Why wouldn't you do that? Okay, and it's very pleasant once you get used to it. Why not try it for a couple of months? But anyways, this is a typical high-fat phony outcome, just so you know, okay? All these people are trying to sell you all this BS of soy and all these high-fat nonsense foods, olive oil, omega-3s, nuts, and seeds. It's BS. All right, well, anyways, I'm just telling you, this is how it goes. This is typical.